So, why the last lecture we discussed why fascial therapy works even if it's gentle. If it's somewhat hard or somewhat fair with pressure and friction, we know that for a fact that it could really affect the hyaluronic acid. Pero how about those techniques na like Bowen, craniosacral therapy, what else, kinesiology taking? Why are those techniques really works even if the even if the touch or the procedure is quite gentle? So according to Schleip, or however he pronounces his name, is a German fascial research proponent. Um, According to him, okay, when you do manual therapy, fascial techniques, manual therapy, or whatever kind of manual therapy, you might be stimulating the GTO, or the Golgi tendon organ, which could then result in lower firing of certain motor neurons, and consequently a reduction in tension of the muscle. So, pag di ba, pagka nag-contract yung muscles na stimulate mo yung Golgi tendon organ with tension, apparently it would then cause some relaxation and reduction in tension in the muscle. However, passive stretching, okay, take note of this kasi may error yata dito sa napadala. Stretching of a muscle does not stimulate the GTO. Okay, if you want to have a good effect of the GTO, there should be at least a good contraction. Very even mild contraction would affect the GTO, just giving you reduction of stress. So pag nag-stretching ka lang, you don't really stretch much the GTO. So ang nangyayari lang is that you might have elongated tendons and just part of the ligament, but not really not really affect the GTO. Also, this set of uh, researchers on fascia found out that there's a lot of um, mechanoreceptors in the fascia, particularly in the thoracolumbar fascia. So there's a lot of mechanoreceptors like your Pacinian corpuscles, your uh, Paciniforms, which are smaller, but, and then you also have your Rufinis, and then your interstitial group of muscle receptors. This set of muscles, or this, I'm sorry, this set of nerves, okay, bring forth signals that would eventually relaxes the system. Okay, we know that Pacinians and the Paciniforms reacts with vibration, right? And then your longitudinal finis organs reacts with heat. Okay, and then your interstitial muscle receptors found everywhere. Okay, along the muscle and even in the tendon. Okay, it reacts to almost anything. So it is oftenly depicted as a group of Italian family, they call it. Okay, this is the Italian family, and the Golgi organs, or Golgi tendon organs, and Golgi end organs. You're the Pacini or the Pacinian, Rufinis or the Ruffinians, and the interstitial sisters. Why is it called interstitial sisters? During the time of this research kasi, seemingly mas maraming babae kaysa sa lalaki. So they're more abundant in the muscle and the fascia. That's why it's called interstitial sister. And it always reacts to almost anything. Okay, that's why it's called interstitial sister. Medyo chauvinist na dating. While with Golgi organ, Golgi tendon, it reacts with, as I've said, with contraction. That's why it's being depicted as a muscle man. Okay, Pacini or the Pacinian reacts with vibration. That's why it's always correlated with the jittery guy. Yung kaibigan mo pag hinabak mo, nanginginig. So, yung biglang magugulatin. Kasi it readily reacts with vibration. When the Rufinis reacts with the heat and slow reacting. That's why it's being depicted as like a stockbroker or stock player. Kasi hindi siya basta-basta nagre-react. Okay? It takes some time for us to really feel heat. Okay, aside from finding out that the Rufinis reacts with heat, okay, these researchers also found out that it also reacts to pressure. Kaya nga react to pressure, pero para rin silang uh, stock traders. Diba? may pressure pero hindi sila ganoon kabilis mag-react. Diba? Even nagpa-fluctuate yung market, for example, sa stocks. Hindi ka naman basta nagbumaba yung stocks, di pa bigyan ka kagad. Hindi. Diba? Ang stockbroker, good stockbroker would always analyze. Okay? It would take some time before it reacts. Okay? Ruffini responds to gentle lateral skin stretch, so you don't need to dig in deep to activate these receptors. That's why with kinesiology taping, di ba masyadong mababaw lang, nagre-react na yung Ruffini's. That's why maganda yung response lagi with kinesio tape kasi mababaw lang. Bowen therapy doesn't have to dig deep. Masyadong mababaw lang for it to react. For it to react. Also, they found out that 80% of type 3 and type 4 efferent, what do you mean by efferent? Sensory, diba? Yung type 3 and type 4, which reacts with pressure, heat, and all those um, other uh, stimuli, medyo mababa lang yung threshold ng pressure, diba? So it just stays on the skin. So hindi sila kailangan malalim yung pressure mo. Hindi nila kailangan ng malalim na pressure for you to affect them. A gentle stretch, just like what happens with kinesiotherapy and with your Bowen. Di ba ganun lang siya? Bowen therapy, ganun lang. Okay? It really have an effect kasi masyado siyang mababa. So you affect the type 3 and type 4 efferent fibers right away. So, what's in it for us, manual therapists, osteopath, manual physical therapists, massage therapists who are doing uh, high-end trainings or high-end treatments? Okay? So, this exploration suggests as the fascial research becomes clearer, we are becoming more aware of the physical stresses and manipulation are not the only way that we can improve and influence function. What does it mean? Hindi ibig sabihin nilaliman mo, tinigasan mo, or masyado mong higpitan yung tinatawag mong release or yung stretch, mas beneficial. Kahit kasi sobrang babaw ng ginagawa mo, it could already affect the skin level. With cupping, kahit hindi masyadong malakas yung pressure na binibigay mo, you could already give um, efficient treatment to the patient and enough neural stimulation. A gentle yet precise movement and well-intended action, no matter how soft, could be an effective therapeutic modality, especially when the fascia is concerned. So, what are those? Kinesiology tape, functional tape, craniosacral therapy, Bowen, cupping, even your eye stim or your H tool, your uh, instrument-assisted soft tissue mobilization techniques. So not only as osteopaths, but as manual physical therapists and all those dealing with a lot of soft tissue technique or soft techniques rather, fascia manipulation, no, fascia release, cupping, kinesiotaping, edge tool, eye steam, instrument assisted soft tissue mobilization techniques is enough for you to have an effective treatment. Hindi mo kailangan pahirapan yung sarili mo. Okay? All you have to do is just be mindful of the technique, know where you're placing your cups, know where you're stimulating, know where you're placing your tapes, and then you can already have a good uh, therapeutic value for your patients. And as the saying goes, kung minsan, di bali ng tamad, huwag lang pagod. Diba? Minsan lang. Hindi naman dapat lagi kang tamad. Pero even I just want to prove a point na hindi kailangan pagpawisan ka sa therapist, na pagpawisan ka sa ginagawa mong technique for you to put a therapeutic value. Okay? Money is another thing, pero syempre, uh, if you're doing a good technique, diba? Sabi ng iba kasi dapat evidence-based, blah, 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 blah. Okay? We know that evidence-based is good. I'm also practicing it. If you go to my clinics, I do a lot of therapeutic alliances and a lot of talk about pain differentiation. But the thing is, ba, as physical therapists or as a therapist, ba, ang main goal natin is to give treatment and improvement sa pasyente. Okay? Sometimes you don't really have to explain a lot. All you have to do is just do the technique, explain in a way that the patient would understand how it goes, and then voila, you have a good technique. So with this, I thank you for listening for the three valuable modules and lectures that I presented. In the next succeeding days, we're gonna do the cupping itself. Okay, we'll introduce you with the cupping set. I'm hoping if you received them already, uh, I could present it to you. But even if now, you can always go back to this modules so that we can always have a good lecture and good recall of the techniques. With that, I thank you and I see you in the next video.